Hi everyone, this is Jess from STL Fertility, one of the nurse coordinators. I wanted to talk to you in this video about one of your trigger shots. It is called Pregnyl and it's a full 10,000 unit trigger. The first step in any injection is to ensure you have proper hand hygiene. To do this, you will want to use soap and water and then dry efficiently. At that point, you can then gather your supplies for your injection. The first step when preparing for your trigger shot is gathering all your supplies you will need. You will grab an alcohol prep pad. You'll have a syringe with a needle attached to do your mixing. You will have a separate needle that is a 1-inch needle. And then the medication, which is Pregnyl, or it could just be called 10,000 human chorionic gonadotropin. And in that box is the powder of medication and your mixing vial. And then you will also need a sharps container. The first step is to gather your needle with the syringe attached. And to mix, you're actually going to mix 1 ml into the powder. You will pop off the top of both of your vials. And to do this, you'll stick the needle into the hub, flip over so you have the gravity to help you, and draw back 1 ml. I always draw a little bit extra just to make sure. So if you see 1 ml, and you can pull your vial off, and then you will put this inside the hub here and inject the full 1 ml in. Once that's diluted, you will want to just kind of swirl a little bit. Do not shake too much. You will then invert again. Make sure your needle is below the level of the water and draw back your full 1 ml. Once you have your 1 ml inside here, this is where you will switch your needle. You will twist this off and place into your sharps container, and then attach your 1-inch needle for injection. You have an air bubble. All you will need to do is flick, and then you'll push up so you prime your needle and see a little drop, and you are prepared to give this injection. I'll be showing you how to do an intermuscular deltoid injection, which is basically where you get like a flu shot or a vaccine. So how we're gonna do this, I have Dre here. We are gonna follow her shoulder bone all the way to the end right here. And then what I tell my patients is you're gonna take 3 fingers and put that on the side of the arm and go directly below that 3rd finger right here. So what we're going to do is you're going to have your alcohol prep pad and clean that site. And to give the injection, it's a little different than subcutaneous. When you pinch, you're actually going to spread the skin taut and then put the needle fully in and inject the medication and then pull out. Thank you for watching this video. If you have any questions at all during your IVF cycle, your trigger, always please reach out to your coordinator either via portal or calling at 314-983-9000.